you have providers, you have executive leadership, and then you have other C-suite and operational type of leadership, and they'll come at you from different angles. And how do you get around that? How do you address their needs, their concerns? And so it was basically whatever came my way. I just had to figure out how to best answer for them to make them feel comfortable about what we were going forward with. And at the end of the day, just say, this is going to work. Have a little faith. Let's move forward with this and just see what we can do. And that's a lot of the approach that I took, and just got to still have my fingers crossed that everything's going to work out well. So.
You know, for me, I've referenced this throughout the whole webinar. I mean, I think it's culture. And I think you can't force anything on people. I mean, we work with a highly intelligent group of people. And I think if you tell anyone you're going to do something, I'll use me as an example. You tell me I'm going to do something and I'm like, well, I won't do that. So I think you really have to show people the benefit. I mean, I gave the example of saying I'm not going to do telehealth. And then they said, well, you go to the back of the line. I'm like, well, it turns out I don't want to go to the back of the line, so I'll do telehealth. So some of it's, you know, the CMO now, he calls them Jedi mind tricks. You know, you kind of have to show the benefit. And I think for providers, we like to, I'll say we, now I'm going to be an executive. We like to say they're the difficult people. The providers are the easiest people. Because really they are here to do a job. They are here to see patients. They want to get their job done. They want to see their own patients. And I think that's where, if we can really show them and continue, and we're still working on this because there's the whole back end operational piece. That's where it gets really hung up. And that culture is the one I think is a real challenge. But the providers, if you can say, we'll use this and you can see your own patients and you can talk to them, they're in. They're not, you know, even the pediatricians that want to lay their hands on them, if you're like, but you get to see them and they get to see you and they're not going to be in the ER, you can leverage some things that, again, some mind tricks that the providers just want to do their job. It's really, now we're going to talk about executives, and then it's the staff. And so it's the staff, and it's them of not, again, they're here to do a job too. But their job is to just get people in and get to the next phone call. And so it's remembering and helping the staff just change how they think, because we have done things for 25 years this way. And it's not that they're trying to be obstinate or to do something wrong. It's just when there's an icy day, we just cancel all the patients. But we shouldn't. We should convert everyone to virtual. So it's those little things that are real cultural changes that, again, everybody has the right intention, but how do we start changing those? Like, the first thing I think of is telehealth, not the last thing. And I'm still learning that. So again, you know, the change management curve, your early adopters, your middle people, and then your laggers. But I don't think that people are resistant because they don't want to do it. I think they're resistant because they don't think about it. So we have to find ways to motivate them. And I'm in this really, again, I think the providers are pretty easy to motivate and figure out because I know what their MO is. But I think it's getting them on the provider schedule. And I have not figured out the MO of the staff. Now, the executives, they're a different breed of cat, and I can say that because I am one of them. I am in a weird place because I walk both those lines. But as an executive, I think for them, it's really showing the executives that, you know, there's all this talk now about provider burnout and how do you know, retention. So we've had a lot of turnover. Like every single health system, if you have a health system that hasn't had turnover, I want to talk to them. But so retention, burnout, you know, quality, improving access, and every single one of this addresses every single one of those things. So you have to just look at it differently. So I think when you're talking change management, I think we have a desire to just come in and say, because I said so, because we have a very patriarchal society. That's how I love to practice medicine that way. Take your medicine because that's going to make you better. Do it. people don't do that. They're like, but I read on the internet all the reasons why I shouldn't take the medicine. And so I have to then help figure out, it's essentially motivational interviewing with the
Yeah.
exec team. It's motivational interviewing with my providers, and it's motivational interviewing with the staff. And so we have to figure out the why and understand. And so for the executives, I think it's really, what is going to help you with building and improving patient outcomes, provider satisfaction, and helping us get from here to here. So I think we have to approach it differently. And unfortunately, we still like to just tell people to do it. And we being the global we, not even just Variety Care, but I think that's a leadership. And I think there's a real learning curve to that. So that may have been more than you wanted, but that's my opinion. I've got lots of.
No, if it's helpful, if I deduce, I kind of hear you saying with your executive leaders being able to say, these are the metrics that we're going to move. Here's how we're going to know that we moved them and go forward. Can you just, you did one of these, and I think there were 4 of them in your mind. Can you tell me what those 4 were one more time?
I said provider burnout,
Okay.
retention, quality metrics, and patient satisfaction.
Okay. And are you all measuring that today in your programs today to be able to talk about the gap between one and the other? Okay. That's very super neat. So those are our 4 recommendations that I think would be worth hearing.